to the show. Our three questions that
with Sugar Fix in Chicago with Dr. Jessica Emery. So thank you so much for jumping on.
I mean, I'm still going to work on it, but
yeah. And then right away, as soon as that first thing comes out, they sign up for it.
Hello and welcome to Dental Tech Chat. I am your host, Allie, and I'm here with Jon from the Dental Guys podcast. So we're so glad to have you here and welcome to the show.
Well, very excited to be here with you, and thanks for having me. Wes, the other dental guy, I couldn't be here today, so he kind of gave me his feedback. So I feel like I'll be able to bring both of our, experience into this. But yeah, we've been a fan of you guys for a long time. I'm a fan of the show.
Well, great. We're so glad to have you both here. And we know you guys definitely deal with a lot of cutting edge technology in both of your practices. So it's definitely going to be great to hear a little bit about what you guys have been up to lately. So I want to introduce you to everyone. You guys both bring such incredible things to the dental community and helping our fellow dentists take on their clinical practices and to the next level through discussing controversial and complex topics within your podcast. And I really like that you guys review dental research and to see how it affects your clinical practice and you share it throughout with your listeners. So I'm really excited to hear your guys' knowledge and what you guys are bringing to the table, because I know you guys speak a lot for the dental community, and I've been learning a lot just listening to your podcast as well.
Well, good. Yeah. It's been a lot of fun over these last few years getting to, take it from something that was kind of just a fun little project at the beginning, a kind of a hobby, to where it's become, almost a job, which is good.
Oh, yeah.
It's what we kind of wanted, but yeah, we've gotten to meet a lot of really neat people, see some really cool products, and, get to the point where, people do sometimes actually ask us some questions about what they should buy or what they should do. And that's, it's kind of a humbling thing, but it's a lot of fun.
Well, like you said, you guys can really get the honor of kind of getting to jump around and see new products because, since you've been out in this community and learning what, they want you to test it before maybe someone else does. So it's really neat. You guys are able to share that knowledge with everybody. So I kind of wanted to ask you, when you guys got started with your passion project, like you guys probably, I've seen all of your guys' about, and I really love that you guys had met at a CE and going from there, what drives your guys' passion to do the podcast now? Is it just kind of constantly wanting to build in advance, or just kind of share with us maybe what drove your guys' passion to start the podcast? It's been so neat to see you guys grow.
Yeah. So, back, we had always listened to podcasts for years, and actually a lot of podcasts on tech. That was actually our kind of first thing we were into back in the day. And so when Wes and I met, like you say, at a CE event, we didn't know each other, even though we practiced just a couple hours from each other, and met actually at another country at a random implant CE event. It was just crazy. But anyway, we started talking back and forth then. And had this kind of Google Hangouts messages going back and forth about research and products and what are you doing and what are you using and what educational events are you going to and that kind of thing. And one day we just said, wonder if anybody would want to listen to this. And maybe probably not. And we thought, but we'll just give it a try for 6 months and we'll see what happens. And at first it was, of course, as anything, there was probably my mom was listening and that's about it,
Oh, yeah.
And then eventually, it turned into something, and we started getting it was through a lot of product reps that started listening to what we were talking about with products, started kind of spreading the word about it. And so where we are now with that, after, 150 some episodes, we're at the point now where it's been cool, because now we have people, approaching us and saying, hey, we'd like to talk about these products. We'd like to tell you what's going on. So it's kind of been a balance of now, we want to know what's new. We also want to talk about what works, and how that kind of benefits the daily clinical practice. So it's been a cool thing to say. We get some researchers on who are doing this, day-to-day research in the university level, combine that with the clinical side. And it's been fun. And our thing, our thrust with the whole thing now is we want to help, whether it's a new dentist or a seasoned dentist, be able to, take something that we may go to a meeting, we may read some research, we may do some product evaluations, but let's boil that down into what works and what is proven. And that's really what's driving us forward now is, in our own practices, we've tested and done a lot of work with that, but also, taking from some of these really bright minds that we get to have on the show gives us ideas of kind of where to go next. So it's just really, and to our listeners push it, they're always telling us what they want to learn more about. So we try to tailor it, to what people want more of. So that's kind of where we're at. It's been really a fun ride.
Gosh, it just sounds so incredible, everything you guys get to do. And it's just excellent that you guys, like you said, get to share so much knowledge. And like you said, like from educational to startup to seasonal, like it's just got to be so neat to be able to hear and learn from everybody's opinions and also their knowledge, and then take on that and implement it into your guys' podcast and share it with us.
Yeah. Yeah,
And like,
absolutely.
I'm sure, like you're saying, it's definitely become a job, and it's crazy because even starting this, like you said, it starts so small, and then to see it envelop, it's just been so neat to like constantly be gaining from listeners and from also just learning from other dentists. Like I just literally cannot believe the things you guys get to go and do throughout your guys' clinical practice. And then you guys can share that with us. So I think so many dentists get to get so many great things from your guys' podcast.
Well, I appreciate that. I think, yeah, where we are now in kind of learning, especially COVID has brought this out even more, but even
Yes.
before that, you know, it was, people are going, you know, there's not been as much of a source of you know, people aren't going to as many meetings as they
Nope.
used to, which, you know, we kind of are sad about that. We think there's a value to the in-person learning. However, you know,
Yes.
people want to go and find reputable sources for what they should be using, what they should be doing, what works in clinical practice. And it's been a niche that, you know, we've partially been able to fill, which is really fun. And you guys are doing kind of the same thing, you know, trying to
Yes.
expose people to new technology or things that people are using that are working. And so, yeah, we love when we especially love the podcast where it's based on day-to-day, you know, technology,
Yes.
clinical things like that, things that are, because there's so many business podcasts out there, which are great,
You're
but
right.
it's
Yep.
a little harder to, you know, to find the hardcore clinical day-to-day stuff, because it takes a little bit more work to develop a show like that. So kudos to you guys too
Yes.
for trying to make nuts and bolts really work here with because that's what people I think need in their daily practice.
Well, thank you so much for that. Because really, yeah, I was sitting here going, you know, like you said, that day to day where we were at events to, you know, educate dentists on what we're providing in the new innovative technology industry. And then we were just like, you know, you need to hear from actual dentists. We need other dentists to connect. And we love that we can bring them here to this community as you guys do. And you really just share your guys' everyday, what are you guys using in your practice, in your hands, what's been working and what's getting your guys' you know, efficiency and productivity boosted. And that's what's really been really neat about this podcast, to really hear from you, what the dentist and what your guys' dental hygienist teams are using in your practice. That's been a big benefit. So it's just really awesome to be hearing everyone's, you know, success stories, but also kind of hearing, hey, maybe do, you know, research. And that's what's been really awesome about this podcast. And it's also what a lot of you guys do, you know, and I think it's great. And I've been learning a lot even from now jumping into the dental community. And I was really excited for, you know, the Voices podcast to like go check you guys out there, the Voices of Dentistry. And I was like, dang, it got canceled. So I'm still looking forward to that in the future years.
Yeah. One of these days, we'll get to be back to those meetings. You know, we had several meetings that we were going to be speaking at this last year that ended, of course, getting canceled and postponed or became virtual. So now we're like recording presentations virtually to be, you know, given, which is it's just a weird world, you know, but yeah, again, like the day to day, that's what people are really wanting. And, you know, for years, either it would be going to meetings or it would be maybe some of these, you know, monthly journal type of things people would get. And I think that to some extent that's just, you know, people don't know where to turn. And so, yeah, if we can give them more of that, you know, that's really the key.
Yeah, and I think the key too has just been so neat to use, like you said, the real world, but it's really put us all more into the tech. You know, everyone's becoming more tech savvy. Like, you know, they want to learn Zoom, they want to get on social media. Like, I just think it's been really great because this has been a really great educational tool as well. Like you said, if you can't get in person, you can just hit the play button and make your car become kind of like your CE. You know, you're learning as you're driving, which has been really neat. So yeah, I just really think it's been really great what you guys have been doing also in teaching the whole dental community. You guys have really just brought such great advantages to us and teaching everybody really, which has been awesome with these podcasts. So that's what we're here to do too, and connect everybody. So it's awesome.
Absolutely. Well, thanks for that.
Yeah. Absolutely. You're welcome. I now wanted to ask you our very first question. So this is our diamond in the rough. So this is something you guys have been using in your practice that not maybe everyone knows about, but that's been a big advantage in your guys' practice.
Yeah, so I kind of have two things with this, and one is a very basic piece of technology, and then one is maybe a little bit more specific. So I'll have one clinical thing, and then one maybe straight up technology thing. I'll start with probably the tech thing, which is actually a piece of software that's called Venga, and Venga. And it's a piece of software that's a in-office messaging software. So, you know, years ago in dental offices, those who'd been around for many, many years, there's been all these little ways for your hygienist to let you know that they're ready for you to check them, or your front office team to let you know there's a patient here. without your assistants having to go, hang out at the front office and wait and kind of waste their time waiting for patients to show up. But the biggest thing I think has been communication between operatories in the office without having to get up and leave the room. And there's lots of softwares that that are out there for this. So it's not like this is unique, but this software is, I think, the best one out there. And yet I don't think a lot of people know about it. It's by a small company called Apple Butter Software, kind of a random small company that for years ago, we discovered it when we were building an office and getting our technology together. We had our IT company tell us about this software probably, 10 years ago. And it hasn't really changed very much, which is good because it's a very basic. There's a kind of a visual where you can, and for those who are listening to this, just, go check it out. If you Google it, it'll come right up. But basically there's colored little buttons that you can click on and then click on the room. So what'll happen is, say you want a doctor to come into your hygiene operatory because you're ready. The hygienist just simply clicks the name of the doctor and then their room. And what will happen is there'll be a little noise that you'll hear that starts, and there's a timer that starts. So if you have, 2 or 3 hygienists, you can see who got you first. So because that's always an interesting thing when, you might have 2 or 3 hygienists all waiting. It's like, well, who's first? Who's the first one? And you definitely don't want to make them upset by skipping, who was first. So, yeah, exactly. We need to be fair and in order. And then also, if you have multiple doctors in the practice, sometimes it's difficult to know who's supposed to be checking that patient. You might not know whose patient it is. So essentially, at one glance, you can see where you're supposed to go as the doctor, which room, who's been waiting the longest, and for sure that it's your patient. And also it's the same with, calling an assistant into the room or the front desk. And at the same time, you can send text messages very easily and quickly through the whole office or just specific rooms to say, let a patient know that, or let the team member know that the patient is there. So it's just one of these little things that we use literally all day, every day. And it has simplified our workflow kind of on a daily basis. So I think that would be the first thing I would say. It's just not as well known. So go check that out. The other product. Yeah. And the other product is actually a clinical product, which is a Composite Warmer. We talked about this on our podcast about a year ago. And, when you are using composite fillings, the material, if we warm it, it becomes a little bit easier to place. It becomes more flowable. It's just a lot of advantages clinically. And you don't have to spend a lot of money on this. We actually tested several of them about 1.5 years ago. And found that just a simple coffee mug warmer that you can get on Amazon, and you can go back and check our podcast out on that. It costs $25, and it's something that will warm the composite up to the right temperature. And it's something simple, and yet day to day, it makes a huge difference on how efficient I can be. I'm getting a little bit better result. Maybe a lot better result with certain things. And again, a lot of people just aren't aware of it. Or maybe if they are aware, they've seen these really expensive ones you can buy for, $500, $600. And you really don't necessarily, in my opinion, have to go there. So that's a couple of products that I think and Wes and I both use those same 2 products in our practices. And we've proven them over the last couple of years. And yet a lot of times we talk to people and they've never heard of either one. So yeah, definitely something to maybe for your listeners to check out.
Yeah, these are great pearls, I think, too. And I guess, for real, just really great time management, especially that first tool. And can you say that again for our listeners? That will be, because I know, a few other softwares, of course, Asana has been big right now, like you said, but this one sounds really neat because I've never heard how it's color-coded and it keeps kind of your task management where you'll know who was first in line, because that's usually, you can put a priority setting, but that's really nice that that's a notification to let you know, hey, who needed you first.
Right.
So
and
awesome.
it's called Venga, Venga by Apple Butter Software. And it also does kind of neat things like you can set it to send those messages to your phone or your smartwatch. So if you're in a room and you don't have a computer monitor easy to see, you'll get a little notification on your watch or on your phone that somebody needs you in a specific room. Even if you're out of the office, they can still send you messages if, say, you're at lunch. Anyway, it's a powerful little piece of software for being something that's relatively easy. And there are other ones out there. So if there are other companies, that they have some good ones too. I know Yappy has one. There's several that are, I'm sure, very good too. But this has just been one that for us has worked really well.
Yeah, it's great to hear that's up to par just as well. And it's bringing also some other definitely add-ons that, you know, not other softwares are doing, but again, they've all definitely got a really good niche and they work very well in a lot of people's practices. So thank you for sharing that with us.
Sure.
And I think it's really cool too, like the hack with like for the composite to warm it up with just a coffee warmer. That's awesome. I'm definitely going to put that down below, find your guys' podcast and make it for people to just easily find it for them.
Sure.
Yeah. So I really like my second question. It's the best one. It's my favorite because I like to hear your guys' is like no risk, no reward. So when you guys go in, you know, and you're looking for technology, you're kind of like, you know, going on the gamble. But when you figure that out, you know, it comes out to be a big advantage usually for the practice.
Yes,
absolutely. Is there a product you have in the practice that's really kind of done that for you guys?
Yeah, and this is maybe going to sound like what you would expect a lot of people to say, but it's definitely been cone beam CT for both of our practices for sure. No question about it. When we look at what it's allowed us to do, it's a big investment for sure, and you know, something that everybody has you know, been looking at. I think every single dentist either is looking at it or has already purchased it. You know, they know that they need access to it, and I think that, you know, every practice needs access to cone beam CT, whether it's at their own office or maybe a specialist that has one. But, you know, if you're on the fence about this, there's just no question that this to me is the biggest bang for the buck that we've had. You know, so when we bought it, we were, you know, my goal with it was mainly implant dentistry. And I think it is for a lot of people that buy cone beam CT. And that's been, you know, it's indispensable, of course, for that. It's allowed me to do so many implant cases that I otherwise would have referred because I really didn't know what I was getting into. And now I do. And it's not only increased the cases that I do, but it's also increased just the overall number of implant cases we do, whether we refer them or do them in office, because we just know so much more now. We can show a patient what's going on. It's an educational tool. The diagnostic side of it, I mean, for things such as, you know, fractures or infections that we're not sure where they're coming from, or symptoms we're not sure where they're coming from. That's been huge. With airway, it's another thing that has been major. And, you know, a lot of people look at CT and they think, well, you know, is it going to actually pay for itself? And I don't think it really pays for itself per se in terms of charging for the scans. I don't think that's really the payback. I think it's what you get to do as a result, you know, procedures that you get to do that you otherwise just wouldn't do without it. And so it's been something that, you know, we've had it, both Wes and I have had in our practices now for almost 4 years now. And it's just totally changed, you know, what we're doing in our practice day to day.
Yeah, I think it's just such an incredible tool. It's a big advantagement. Like you said, you can get a lot more done. You're not sending cases out. And then it's really great for patient education. Like you said, it really accelerates that and their understanding, because you guys said that whole image of the mouth. It's just such a great tool for like the wow factor. Not only that, but it's almost become, like you said, 4 years, almost, and most people are looking into them. It's modern practice if you're doing the implants, for sure.
Absolutely.
Yeah. Do you know which brand, if you want to share with our listeners, like which one you prefer or which like type of CT you would recommend?
Yeah. So, and I would too refer you back. We did a podcast on this probably a year and a half ago, which is still pretty relevant to today, about different CTs. We actually went to a implant planning lab that just makes guides, and we looked at hundreds of actual scans, because when you look at specs for these companies, so what Wes and I both have is a race scan unit and the race scan alpha expert, and it's a great unit, and we can talk about why. But there's a lot of good ones. It's not like there's just, of course, one good one. But what I think you have to look at when you're choosing these things is what we found anyway, from looking at a lot of scans, is just the price does not equate to a better scan necessarily. Now, some of them are better that are more expensive, but we've found some that were really expensive did not give us as good of a quality sometimes as what we were getting even from like a lower price. So the price wasn't necessarily the price, or the brand didn't necessarily equate to better quality. It was more about things like looking at the features, you know, the size of the field of view, how much do you need to see? Looking at the scan time was super important, because patients can, of course, move during this. Do you want a unit where the patient can stand up? What about sitting down? How you position the patient, you know, matters a lot. We like the units where you could easily bring it down low enough that a patient can sit in a chair so they're not moving, or having a faster scan time. So I think where we are now with it is you have to first decide, you know, what are you going to use it for? Do you want to do, airway type of things? Are you looking to do, orthodontics, orthognathics? You need one of these big field of view machines. If you're looking to do, mainly implant dentistry and diagnostic dentistry, you can choose one that has a smaller field of view, which not only gives you usually a little faster scan time and a smaller machine, but also avoids really having to read an entire cone beam CT of the entire head and neck, which increases your liability too. I mean, you don't want to necessarily have to be responsible for more than what you know enough about in order to diagnose pathology and things like that. So that's kind of been our game. And I think now, there's probably 5 or 6 different brands that we've seen that produce. And what I would say, if you're not sure about what to buy, talk to the companies for sure, and find out what the specs are and understand that. But also I would say go to, some of these implant surgical guide companies that are seeing scans all day long, and try to ask them, well, hey, what are you getting the best quality from? What scans are you finding are giving you, what scanners are giving you the highest quality scans? And they'll tell you right away, like, it's this, this, and this. And that's something that should direct you back to those companies and saying, okay, well, if it's a good quality scan, that's number one. But number two, how long does it take to do the scan, and how big is the machine, and all those things. And then of course the costs. But we've just found, like, not necessarily the most expensive, like I say, gives you the highest quality. It's more about what you're looking for in terms of the quality of a scan maybe first.
Right. I think you touched on, like, most of the key factors of, like, when you're going to look into, like, a lot of technology really, but like you said, really going to talk to the guys, like, who see those scans every day. That's got to be major. Cause like, that's a benefit that I don't think everyone thinks about, to like actually go talk to that expert. They're seeing it way more than, every day. Like you said, it's not always about the price. It's what are you using it for? And I think that's a big question. I think a lot of dentists, like, you kind of get in the moment of, okay, you want to start implementing it, but what are the cases you want to start taking on?
Exactly.
So that's really, really great knowledge, because I think, again, you're definitely, looking into a piece of technology. You might just want to jump into it. Or like, again, like I've had some people say, like, they want to get into like CEREC or, doing the crowns, but what's your turnover? And you got to realize when you're implementing a new piece of technology, right, it's going to change a lot of your systems, changes the process a little bit. So you got to know how you're going to squeeze that in and how you want to implement it with the team.
Yeah. We talk about this all the time, and we've talked about it in several of our podcasts about exactly that, is, that it is, we as dentists are so technology driven and product driven. And sometimes you can, you go to a show and somebody shows you this great, cool thing, especially, and I think, you mentioned CEREC, and, we won't go too far down that rabbit hole, but just, it's a great example of how, you look at something, you're like, wow, that's very cool. And that is the first, you're like, man, I want that. But the question isn't, whether or not that's cool or whether you want it. The question is, does it make sense for your practice? And are you willing to change your entire workflow to accommodate this piece of technology? Then two, is it going to pay for itself? And I think, you can talk to people that they've changed their whole workflow for something, for instance, like in-office milling, and it's working. And but for every one of those, there's also a fair number of them that we're finding that are not really happy with that decision necessarily in terms of the day-to-day workflow. So I think cone beam CT is an easier pill to swallow in a lot of ways, because it's clear to me that it gives, I don't think there's any case that I've ever heard of where you don't hear somebody say, wow, that changed my practice, and it wasn't difficult to get a return on that investment.
Definitely, that piece of technology is it really helps more right away. Kind of, you're going to start using it and you're going to see it can be implemented a little more seamlessly. It's not changing your day to day as much, just because I think it's right there with, like, it's within the, radiology. It's right in that field, so you're going to be taking your 2D, you're going to want your 3D image. It just goes hand in hand. So immediately advantages right away with that piece of technology. So I definitely couldn't agree more with you on that. But everything works different for every practice. That's what you're saying. Some people need, different adjustments, even with the CT. Do you want your patient to be able to sit? Who are you working with?
Yep. Exactly.
So great. So this also brings me right into the flop. So this is our third question, and this is a product you bought. It could be anything technology or just a piece of equipment that you thought you were going to get into, and unfortunately just didn't turn out the way you thought it would. So
Yeah. And this is, so I got two things for this too. And one of those
All right.
comes from Wes. So I'll just kind of mention this and then I'll talk a little bit more about the
Perfect.
one that I've spent more time with. So that was Diagnodent by Cabo. That was Wes's product. This was years ago.
Yep.
Cabo came out with Diagnodent as a way to help diagnose decay, especially on your grooves on the top of the teeth. And, obviously there's people that like it, but the research since that time has shown that it's really not very accurate compared to just a visual inspection of the tooth. So it's, again, kind of a cool tool, but it may possibly result in over-treating teeth. And so, Wes, I think, spent, a good amount of money, as not cheap, on that back in the day. And I think it now is in his closet. So that was his product. He said that he felt like was a flop for me. And this is maybe, controversial for some, but I think it's 3D printing for in my practice, because, and I didn't go full in on 3D printing, but we looked at it pretty heavily, bought a printer. And I started looking at whether we could do printing in office for bruxism splints, and even looked a little bit at printing aligners for ortho. And, now there are people that are doing this just like anything. If you are into it and you want to learn the software and you want to learn the hardware and you want to troubleshoot. But really what I've found with it is that it's not so much the money investment, but the time investment is not necessarily worth what we're seeing as far as the results. So what we looked at is, okay, how long does it take you not only to, because somebody will say, well, it takes me $2 of resin in a 3D printer and just a couple of hours to print a night guard. Isn't that awesome? I saved so much money. And, then you start to look at, well, how much time did it take you to deal with that, the design and the software and the communication between the different softwares, and then maintenance of the machine if it goes down. Really, you have to have somebody in your office that is trained almost like a lab technician to be able to run these machines and troubleshoot these machines. And then you start to think, are you getting the same quality as well on the materials that you're actually getting back compared to what you could get from the lab? And time is money. And I think that that's something with 3D printing that I definitely found after kind of playing with it a little bit. We looked at it and went, unless you have, now if you're the kind of doctor that just loves to tinker and that's your thing, and you love to hang out at, after work and play with your 3D printer and that's your world, then have at it. But I think for majority of people, that do a lot of printing, that's their personality type, is they love to tinker and play and they love the lab work and the behind the scenes, and that's kind of their life. But when the reality hits, if you have a busy practice, you don't have time to do that if you're the doctor. So you have to delegate that to someone else. And you think, well, is that really the best use of, say, a dental assistant or somebody else versus them being chairside with you? How many more, for instance, night guards could you make just time wise through the lab versus what you're paying, and then how does it actually equate? And then aligner technology, again, I won't go too far down that rabbit hole, but just to say that's just compounded, because now you're talking about designing how the teeth need to move, or there are companies that can do the design and you do the printing, and you just start to look at this and go, I don't know very many people. It was such a huge deal about 2-3 years ago. People like, oh, we're going to print our own aligners. We're going to do our own Invisalign. It'll be amazing. And there's a few people still doing it, but there's a lot of people that spent, 10 grand on a machine and software and everything, played with it, and now it's sitting in the closet. So for me, I think that's the lab still has a huge leg up on us in terms of things like milling and printing, because they're investing in the capital technology, because that's changing all the time. It's getting better all the time. And for me, and Wes too, we've just kind of found that we like the idea of doing what we're best at, which is the actual clinical dentistry. We're producing, we feel like we can produce more if we're delegating some more of those things out and letting someone else kind of do the behind the scenes with the printing and stuff.
Again, I think the delegation is number one. Like you're saying, a lot of times you got to know what you're best at. And then, time efficiency, again, it's kind of a key player sometimes. If it's just not, in your ballpark, just because right now, like you said, if you're already such a busy practice, to implement that sometimes does slow down the system. And, you got to have that time. And that's the biggest thing. Time, cost, quality. I like to say it's the biggest thing with technology too. really do that research to understand those 3 key elements, because without those, you know, you really just might run into a big mess. And again, have something sitting in a closet and you spend all that money on it. It's like, that's not what you want to happen. If you're going to implement a tool, you want to be using that tool. And I mean, I think that goes for anybody. I mean, that's just the golden rule, right? You don't want to get something and not be using it. So
that's right. And I think with any of these things, you know, finding a practice that's using it, go and visit that practice and actually see what they're doing and see if it makes sense for you. Because, you know, again, with something like 3D printing, I went and did that. I had a couple friends that were doing it and I said, well, let me come see what you actually are doing. And the more I talked to them, the more I saw it, you know, I heard a lot of things like, well, yeah, sometimes this doesn't work exactly right. So we have to do this and this and this. And I'm like, well, how did you learn that? He's like, well, we just had to mess it up a few times. And then we kind of figured it out or called the company. And I'm going, man, you know, this is a lot of, you know, just again, tinkering in order to make sure this is right, just to say that you have it, you know? And I think that's kind of what it comes down to sometimes is like, we have to be careful not to just say, well, I have this because it's cool. That isn't a good enough reason for a business, in my opinion, to invest in something. It can't just be the cool factor, unless you're just playing and having fun and that's your deal. Well, then, you know, hey, good for you.
In some dental practices, they definitely have that guy. That's the tinkerer, you know, maybe they have that within not all budgets, but some do. I mean, it's just incredible that they maybe can get that figured out. Once it is working, that's great. Cause I mean, it is pretty, like you said, it's just hit and miss with whatever practice, how you're implementing it. But again, I do think there's still so many people who do still want to use, you know, sending it out. And that is not an issue at all, because what works for one practice is going to work differently for another. So it's all just really great how it can be implemented and changed. But again, time, cost, and quality, that is my number one thing, because the efficiency for your patient, you know, you want them in and out, and also for you to be doing your best dentistry and keeping your workflow constantly moving with success. So awesome. I wanted to really quickly ask you, for you and Wes, but really because I have you here, I wanted to know, like, when you guys go to teach your guys' patients, like about, you know, your technology and your practice, like you said, a lot of people like, you know, how you educate your patient on it. So a lot of times it could be, I know you guys are so really great about being personable. That's like my number one thing. Like right when you go to your podcast, that's number one. So you're not very, you know, in the end of the day, I think too, a lot of dentists is why I'm asking, because they feel the pressure. And I think you guys have been on the podcast industry a lot. I want to just say, it's like that, you know, you are selling your dentistry. So that's why it's just kind of a question of how you guys kind of educate your patients on your technology so they understand what you're offering. Yeah.
Well, I think certainly, I mean, everything is selling, right? I mean, that's definitely true. You know, we're selling something all the time, no matter what industry we're in. And in dentistry, you know, what we look at, and this isn't, you know, coming from me, this is coming from some of my mentors, is that, you know, we're selling health. It really is what it is. So when it comes to technology, the focus that we've always tried to have is, how does this technology benefit the patient? I don't want the patient to just be wowed by the fact that we have stuff. I want them to say, you know, this is actually going to make your dentistry better. It's going to make you healthier. It's more holistic. And I think that's a word that we like to use. And it maybe has a bad connotation for some, but it's the idea of just treating the, you know, more thorough treatment. And so a few ways that we've done that, just day to day, one of the, just a kind of an idea that we, both Wes and I use a lot, is when a new patient comes to our practice, and we have different ways patients can enter our practice if they choose. But when they come in as a new patient for a comprehensive examination at our practices, they get a tour of the office. And one of the things we always do when we give them that tour is we bring them by and we show them some of the technology that we use. So we show them digital scanning, intraoral scanning. We show them cone beam CT, and we don't, you know, go into great depth, but we just say, hey, this is, you know, our CT scanner, and not everybody has this. And this is what this allows us to do. We can, you know, essentially look at where we're going before we go there. And it's kind of like doing, you know, surgery on a model first, and then we can, you know, we know for sure it's going to work, and we can diagnose pathology. We can see things now that we couldn't see even just a couple years ago. We see it every day. We show them the intraoral scanner and talk about some of the benefits. You know, you've had that goopy impression stuff before. We don't use that as much now. And, you know, and, you know, to us, that technology is pretty basic now. It's something we've seen, but to the patient, it's such a big deal. Chances are they've probably not seen it before. And so just things like that, just showing them in the office, and our team kind of it's almost like just becomes a script, you know, because to them, it's like, I don't know. It's like the band that plays the same song at the end of every show every night. It's like to that band, that song gets old. It's like, they're like, oh, do we really have to play that again? But to every audience, that song is the one they're waiting for, right? So it's new to them. It's something. And so we have to keep that, idea that patients with technology, they don't know anything about it. So we have to look at it as we're telling the story every time somebody comes to the practice. The other thing we do, actually that I'm working on now is I think that there's a huge benefit to having video on your website and social media that features technology. And so I just, had a video team come in. We're just finishing this up for our office, and, just show what we're doing on a daily basis with technology in the office. And even if it's just showing somebody, the doctor manipulating an intraoral scan and showing that we're not using impressions, or looking at a CT, like patients are blown away by that. And it just, you get this perception that this office is doing the latest and greatest. So I think part of it is, showing patients, and then part of it is, advertising, marketing that. And then of course, while we're using it, we're talking about it all the time. When we're using an intraoral scanner, we're talking about how it used to be and why this is new and what it does for us. And we have patients all the time that come in and say, I heard you guys have this new technology, and I hate impressions. So that's one of the reasons I'm here. I mean, we do have sometimes even patients come to us just because they know that that's what we do.
Yeah, I think going, the extra mile, like you're saying, and really just showing your patients what you offer. I think you really made it really great where you kind of have that personal touch where they actually also get like to walk around your office and see right away, like as like an office tour. Like that's gotta be so wonderful for them. Like you said, it's the same old script, but think about it. Every time you go on an airplane, you want to be told, how to safely, if you had to, get off or understand everything in that side of that plane. Yeah, but someone who's first time flying, you have to know these things. And I think it's just so great that you guys can implement that and make it so personable for your guys' patients. Yeah. And then again, that is really great to touch on, using video. I think, people are definitely now that it needs to be done because, like you said, you don't always get everyone types the same paragraph sometimes. And what stands you apart is just showing your personality, showing what you're offering. And again, using the video has got to be so nice because like you said, you can just pop that video up and now you can be directing them to your website. So they can see exactly what you're offering. So maybe now you don't have to do so many walkthroughs because before they even show up, they know you offer this. So they can just call you and ask the questions. So
exactly. And that's kind of almost. That's exactly our idea, was to take that tour and to say, well, let's do that virtually. The same as you would tour a home virtually, the same as you were, how everything now is going that direction. Patients want to see what they're going to get before they get there. And I think if that's what you're putting out there, is that you're selling health, and you also have technology that assists you to do that. And you combine that with, the personal side of how does this benefit the patient, not just how is it we look cool. Probably the best book I've ever read on marketing is called Building a Story Brand. And the whole idea of a story brand is if you want your brand to really be successful, you need to tell a story. And the story isn't about actually you, it's about the person that you're trying to get to come in. And the hero of the story needs to be the patient. And if the hero of the story is the patient and not the office, then you're going to have success. And that's definitely been what we try to refocus all of our branding, all of our marketing on. How do we create a story where the patient is the center of that story? Because so many times we're like, well, we want to talk about all the stuff we can do. Right. But really, that's not the patient's focus. They're like, what can you do for me? It's about them. And so that's where I think technology, if we focus it that direction, then it becomes a personal story for that patient. So anyway, I know that's a little philosophical, but it's really made a difference in patients, how they respond.
Yeah, I couldn't agree more because when you do, it's about their comfortability, about their health. Because really at the end of the day, like you said, if they feel good about the service they're getting, then, they're going to walk away also with an experience that they'll remember. And once you build that relationship, they want to come back to your practice.
100%.
So it's definitely all links in a chain that are just so important. So I really thank you for sharing that with our listeners today. And I really think you just touched on some, very exceptional points and how you're going to make your practice be more successful, telling a story, make it about your patient, and also tell them what you can offer them, but let them know through almost their own perspective. Break it down for them, like, what a CT is, but maybe they don't. So again, I would think it's going to be great too, like how we're also getting to like more video tutorials. Yes, people know about intro cameras, digital X-ray sensors, the basics. But again, if you're a startup, you're a new dentist, it's a little bit new to you. So again, you want to have those tutorials out for them. So really awesome to hear that you guys are implementing that. And I think here, a lot of our listeners here, I think this is going to be very beneficial for them. So I hope they can implement it.
Awesome. Well, good deal.
Yeah. So right before we jump off here, is there any way our listeners can connect with you and Wes? And I know, of course, we shout out your guys as a great podcast, The Dental Guys. I was so glad to have you guys on here, but where else can our listeners find and connect with you and Wes today?
Yeah, so definitely check us out. TheDentalGuys.net is our site. It has links to all of our episodes. You can find us on all the major podcast places such as Stitcher and Spotify and Apple Podcasts. And we're also, of course, on social media doing all of our things there. We try to keep people up to date with what we're up to. You can also see us at some upcoming meetings, that'll be
Yes.
once we get back to that. We're going to be doing the Academy of Osseointegration meeting will be virtual coming up, and that's one of our first ones at the beginning of next year that we're getting prepared for. So yeah, 21 is going to be, I think, a little bit more back to normal with places people could actually see us in person.
Yes.
But for now, yeah, hit us up on YouTube or on one of those podcast channels and let us know what you think.
Yeah, thank you so much for sharing that with us. I know they're definitely have to go check you guys out. You guys share such great information. And I know for 2021, we're also hoping to be seeing your guys' faces out and about. And thank you again for being on with us today, Jon.
Yes, you're very welcome. Thanks for having him.
It was so wonderful to have Dr. Jon Rogers from the Dental Guys podcast here today with us to explain his technology and knowledge and advice in what ways he implements technology within his practice. If you guys haven't already checked out their amazing podcast, Jon and Wes from the Dental Guys go over such complex and really great topics in dentistry, and they explain with us their shared experiences and how they implement technology within their practices as well. Me and Jon discussed some really great tools that he's using within the practice. He likes to use Venga, which is a communication software for him and his team to help with productivity and efficiency with having a really good streamlined way to communicate within the practice. I have that linked down below if you want to check out that software. Next, we went over his no risk, no reward, which was his 3D CT. And he enjoys using this for his implant dentistry, and he uses a RayScan scanner. So also I have that down below for you to also check out. Overall, the flop, everyone has a different opinion on what works and what isn't worked for their practice, but he explains to us how 3D milling just wasn't within his want to implement this into the practice. But overall, we got to talk about really great experiences and how you can educate your patients on what you're using within your practice. So make sure you guys tune into this episode if you haven't watched it all the way through. Thank you guys again for watching us here on Dental Tech Chat and supporting us, watching our YouTube or wherever you listen via watching or listening to our podcast. If you guys want to make sure you guys don't miss out on any of our episodes, please make sure you hit that subscribe button and bell notification to see when we post our new latest and greatest videos. Thank you guys so much for watching, and I'll see you in the next one. Bye, guys.